medication for fecal incontinence is.
I don't think there is a medication for
Okay.
fecal incontinence.
And I thought,
yeah.
Jeff, is there? No.
Not when I've
So
ever talked to anybody about it. Yeah.
So we're going to talk about incontinence. So how old is JJ?
13.
So JJ's 13 years young. Gosh, you almost can't even tell other than what we're here for, I guess.
Dalmatians, it's the coloring. It's very coloring.
It covers the gray
Yes.
hair. I need to be spotted, I guess.
Yes, yes.
Anyways, so he has had a history of urinary incontinence and fecal incontinence. So we're talking about incontinence.
Hey JJ, do you want to come over
Come
here?
back over, Jay.
He's like, I really want to snip. Here, snip over here.
So when did his urinary incontinence start?
He has always had kind of a weak bladder, but started actually being legitimately incontinent probably about 1.5 years, 2 years ago.
Okay. And then what did your regular vet do?
They have medications that they could
Like PPA or something like
yes,
that?
give to us.
Have you tried those?
We have not, because we mostly just came to you because we had Hannah had
So-
these issues, so we
Yeah,
needed
you had another
acupuncture.
Dalmatian with nerve problems, so you
yeah.
were familiar with what it can do
Right.
and stuff like that.
Right.
Did they run any urine tests or anything?
He's had urine tests in the past pretty much his whole life. He had a diabetes insipidus test when he was a kid, when he was a puppy.
Because they thought he drank too much?
Because they thought he drank too much and that he wasn't concentrating
I
his
didn't
urine
know that.
enough. Yeah. And we did a trial of, the eye drops for the diabetes insipidus. It made no difference. So, yeah.
And how old was he when he had
He
that?
was pretty young. He was probably about under 2. He was under 2.
So it's amazing he's gotten to 13 with
Yeah.
really minimal.
Yeah. He's always just been a big peer, but he's been able to control it until he was about, 11.
And so with urinary incontinence, sometimes what we're talking about there is just they don't know they're peeing okay, and usually it's like dribbling or it could be larger amounts. For him, was it dribbling?
It's mostly dribbling, like he'll be on walks now and just start to go while he's walking.
And you don't think he knows?
You don't think he doesn't know. Yeah.
And have you found any urine like in
In
his
his kennel,
bed?
yeah, and in his kennel. And again, I don't think he knows because he seems kind of surprised when he wakes up and is in it, so he doesn't make really any attempt to get away from it or anything like that. So.
Right. It's like, how did that get?
Yeah. And we have had a couple incidents of waking up in a dog bed, finding a wet dog bed that he had been sleeping in, and then.
And so we put him on some herbs to strengthen his kidneys, and which I believe was Romania 16.
Yep.
And then how did he do? And we did a couple acupunctures, which we're going to do today too. And how did he do after that?
Improved, certainly. I can definitely see it if we skip treatments for too long, and you and I have worked on kind of adjusting the time frame for his visits out. I think we kind
And
of.
Sarah has other dogs. She's rescued.
Yes.
She kind of rescues dogs.
Yes.
They're never really easy dogs.
No, I'm
Let's
here.
rescue a giant Newfoundland with bladder problems. So you're no stranger to bladder problems.
Yes.
Well, Romani 16 is good for kidney indeficiency. That's a specific diagnosis, which means that they drink a lot of water and they're actually kind of urinating a little excessively. So like if a dog has diabetes insipidus, a lot of times I will try a similar formula to that, and it often helps a lot. But let's go ahead. We start with the chiropractic. Of course, in human medicine, the chiropractic is great for what they call bedwetting in the kids.
Oh, I didn't know
And
that.
it's very, I guess, successful just by adjusting the pelvis and getting the nerves to function better. So I always like to make sure I start with that. And these Dalmatians get a condition called spondylosis, where they get more or less calcium formation along their spine, and it affects their nerve flow. I'm not sure if that's his entire picture. It sounds to me like he had early on, before he ever had any spinal issues. And his spinal issues are fairly minor. Would you agree with that?
Yes. Especially in comparison to my previous Dalmatian, Hannah's spondylosis was much more pronounced.
Yeah. So I think his problems are not just spinal, but spinal, now that he's older, has definitely kind of come into it a little bit. And then let's talk about his fecal incontinence, because we also have that going on.
And that is, in both him and my previous Dalmatian, it's generally around the times that they would normally go, right? So in the mornings or evenings, after dinner kind of thing. But again, walking in or walking out of the house, it often just kind of sneaks up on them.
Yeah.
And drops, and they'll be walking along and just,
It happens.
Yeah, and it happens. yeah. And they're definitely don't seem to be aware of that. Like sometimes the smell is even startling to them. They'll kind of like turn around and yeah. What is going
do they
on?
go in, has he gone like in his kennel?
He
as
has
well?
one in his kennel as well, yeah.
So
And that'll be
fecal
again,
incontinence.
yeah.
And fecal and urinary incontinence, there's some sort of cookbook points we can do, and I can show you those, and I know you already know them because I've shown you before. And then also we can kind of feel a lot of times if their nerves are not working as well back here, that is sometimes where I like to strengthen nerves. We'll do like electroacupuncture. But for him, I think he's been pretty responsive to just doing the needling and the chiropractic. Is that true so far? And when we do an acupuncture treatment for the fecal incontinence, like, do you see that lasting a
Yes,
certain amount
I do
of
see
time?
that lasting a certain amount of time.
Because I don't think that there's really any, we were just talking about this, any Western treatment for fecal incontinence is pretty minimal.
Yes. Well, even for spondylosis, there's really not a
Just
lot.
to be just like anti-inflammatories.
I've been told to consult a neurologist,
Right.
you know, multiple
But I don't
times.
think they're gonna
Yeah,
help you
yeah,
with much,
yeah.
just more medication.
Right.
So here's what to know, I think, is that there's a point above the anus, and that's really good for fecal incontinence, and there's a point right below the anus is good for urinary incontinence. I've mostly with him been just doing the urinary incontinence point, and then it will help fecal too. But we can kind of move it around if we want to. So we do, it's called GB1, CB1, and then also a good point is at the end of the tail. Yeah, and I usually show people how to acupressure at the end of the tail. You only need to hold it for 30 seconds, and even that helps incontinence. It's crazy
good.
that would do that.
It's good while you're watching TV.
Something to do. True dog person.
Yeah.
So the other thing I usually try and do, so I'm going to see if he'll let me do that. He's got enough spinal awareness that it's sometimes a little uncomfortable for them to get that point. So I think I'll do bladder 67. And then we'll do some more kidney points with him. So as they age, you know, their kidneys are often an issue. Anyway, and then when we actually see incontinence, then we know the kidneys are an issue. I pretty much think if there's incontinence, urinary incontinence, then the kidneys are always an issue. I can't think of an exception to that. So we'll do bladder 23, bladder 28. So this is the kidney point, the bladder point.
What do you think, Mr. JJ? You don't really care. You say whatever.
I'm just a laid back kind of guy.
Yes. It's the anti-Dalmatian.
So we got bladder 67. We do CB1. Now let's see if you just hold them straight, I might go ahead and, if I feel like, we'll see if we feel like that's doing enough. Otherwise, I'll do that Dumai where I open up the spine that way. Let's see if I can put him to hold his own feet. He likes to lean against you.
Mm-hmm. He does.
So that one. And we'll just throw bladder 40. Open up the spine that way. So incontinence points, bladder 67, GBT, CV1, GV1. Opening up the bladder meridian along each side of their spine. It's so awesome to do that. You can also do, there's all kinds of other things you can do, but those are just the basics for sure. And a lot of times I'll do bladder 10 with that too, which is way the heck up here on the atlas. Oh, Mr. JJ, he's so good. He's, yeah. Okay, I'm just gonna see how this is. Now, some people would also do, you know, we have done it before, kidney 3, kidney 6, stomach 36. So these are all just different points we can do, but if he feels, I'm just kind of feeling his pulses. It's so weird that he's 13. I mean,
Yes, I did the math.
he's one of those kind of Dalmatians though. Yeah, they can live a while.
Yeah, they can. And he looks, I mean, even for his muscle mass and everything,
I
he looks
think
pretty
so,
good.
for his age.
Yeah, he's not.
Don't you think?
Yeah, he hasn't dwindled a whole bunch, you know.
Would you walk these guys every day?
Almost every day. You know, it's the rotating crew, right? Cast of characters. So
Sarah, you gotta tell people. So you've got a bull terrier.
A Newfoundland, a Dalmatian, and a Jack Russell Terrier, and they're all rescues of a fashion or one fashion or another. So,
Yes. It's sort of like the potpourri of dog breeds. You can't like just stick to one.
Yes, it's true. We've had everything from the 6-pound Maltese,
Ah.
who was like 20 years old, to the 125-pound Newfoundland. So it's
That's awesome, eh?
Yeah.
He's all like, what
Yeah,
dogs have been on this bed?
Thank you for putting this here so I can smell it so easily.
And what do you think about his hips? Like he does lick around his hips, and
He
we talked
does.
about that
He
before.
does, and we've all, yeah, and which is a bit another issue.
Jay, stay with your mom. Jay, stay with your mom.
Over here. Thank you.
He can sit down if he wants to.
Yeah, he
Yes.
always has licked back there, and we
Always has his whole entire life.
whole entire life.
So is it kind of a thing he does when he's
It's
bored?
a self-soothing thing.
Yeah.
Yeah.
So maybe maybe sometimes that's just what they do.
Yeah. And we've tried him on various supplements for that, for both concerns about his anal glands, which it never has been.
I was gonna say,
Yeah.
implants, no.
Yeah.
Hips, maybe a little.
Yeah. And then, well, and certainly now as he gets older, you worry more about
Yeah.
that. But it's been such a thing for his whole existence that we haven't ever thought that was it.
Mr.
Wait.
JJ, do you want to lay down?
Do you want to lay down, Jay?
You want to sniff, don't you?
Jim? And I weighed him out in the weight room. He's like 46 pounds. So
46, and how much was he last time?
let's check.
He was, I can't read my writing, 13 years old. That doesn't help us.
Mm-hmm.
When was his first? 46 pounds.
Okay, good. So he's pretty
That's
solid.
so crazy. That was in March.
Okay, so he's solid.
That hasn't changed.
No. No. And they're still on their primarily raw with some kibbles diet.
Yeah, that's good. I think the diet helps a lot too. Okay, I'm just gonna do a little turn on all of them.
Yep.
So you got his front end?
Yep.
Just in case.
Sort of.
That's right. As much as we have anything. And I'm just gonna feel this pulse one more time. I think I might slide the kidney point in there too, just because, I mean, another kidney point, because I just feel like his pulse is on the right, especially, or he's not quite where I'd like him to be. So let's see if we can do that. Wayne, go ahead and move this guy up here and do kidney 3. Good boy. So kidney 3 is the source point for the kidneys. It's right here on the inside of the back leg.
Isn't that another one you can acupressure too?
Yeah.
Yeah.
You can acupressure all
All
these
of them,
points.
yeah.
It's just some of them are easier to access, you know,
Right.
like GBT is like, oh yeah, most people can remember
Mm-hmm.
that. But kidney 3 is a nice one to do right in the web
Mm-hmm.
at the level of the hock joint. Okay, source point for the kidney. This is great. It's actually right directly across from a pain point, so some people kind of, you can, and especially like in a greyhound that has like a really thin web, you can kind of do both points.
Oh.
Which is kind of, oh, how convenient.
Yeah.
So, yeah, that's a good one. And there's all, like, that's kind of a good thing. You can kind of come up with a lot of different therapies for stuff, you know,
Yeah.
and see what works for a specific dog. And if something doesn't work, you just try something else. But I think the main thing is just strengthening the nerves that, you know, for the bladder, we're thinking of the pudendal nerve. That's a really important one that affects the bladder continence. And I know PPA, you know, that's the drug that phenylpropanol, that's the drug that the vets use. And actually, I mean, as drugs go, it's not the worst drug in the world.
Right.
It was sort of taken off the market for a while for having heart issues, I think. It's a diet pill, kind of like an appetite suppressant in humans, but it just happens to have this sphincter action, which is kind of interesting. And so there's a lot of dogs on it, and it's not the wrong thing to do by any stretch. I think if like it's between that and, you know, that can save dogs' lives, so, you know.
Right.
But they can lose a little bit of weight on it, act a little bit more anxious on it, so it does definitely has a few side
Some
effects.
quality of life issues. Kind of
Yeah, but yeah, so that's the medication for urinary incontinence, but for fecal
thing. There isn't
incontinence,
really anything.
yeah, we just try to innervate the colon better with acupuncture. We try to get the nerves more functional,
Yeah.
so they're actually feeling their colon, they're feeling their anus, they're feeling all of that more, because if we don't have feeling, how can we control,
Right,
you know, the
right.
function there?
And for
I think walking the dogs helps a lot,
yeah.
because that increases peristalsis, and then a lot of people learn how to massage or change or mess with the, I should say, the match.
The matchstick. The matchstick.
Matchstick
Yes.
technique.
Yes.
Did you do that like that?
No, I did not.
You had a certain.
Everybody has a threshold.
Everybody has a threshold. That's right. Hilarious.
That was and for Hannah, her, it was kind of opposite from him.
Yeah.
His bladder incontinence started, urinary incontinence started before fecal. Hers, it was the opposite. It was fecal and then urinary. So, and for the fecal, my regular vets just kind of looked at me like,
Sorry, diapers.
yeah. I don't really know what to
You
tell
make
you.
good diapers.
Yeah, I think we talked about the matchstick at that point in time.
We talked about the matchstick.
Yeah.
All it is to go around the anus and just more or less stimulate it, and that will often stimulate a bowel movement. So at least then you know when they're pooping. It's
Right.
not this like random
Right.
poop situation.
And I know some people with people with pugs frequently learn how to do that just because they're such reluctant poopers in the wet grass or the rain or those kind of things. So they will actually.
They don't want to go out with their feet wet. Oh, how cute! So they'll do the match thing, and then they'll.
Mhm.
That is so cute.
Yeah.
I did not know that.
Yes,
I knew
yes.
pugs were funny about
Yeah.
walking in the wet,
Yeah.
and I never heard of that. That's
Yes.
Are those the same pug owners though that put the pugs in the strollers?
Probably.
Even though they can walk.
Probably. Yes. Probably.
I don't know if I go by them.
Yeah.
I'm just kidding. I love pugs.
Pugs are good.
I just
Pugs are
posted a
good.
pug on Facebook.
Yeah.
Max, yeah. Okay, I'm just gonna do a little turny too on them and yay. Let's see, is there anything else we should talk about? Got them on glucosamine, got them on the whole 9 yards.
Anti-inflammatory herbs.
Mhm.
Yeah, I think that's mostly his.
He just looks like
gamut.
he's super stable.
Yeah, he's been, I mean, we kind of had a little downturn, I think, about the, 11, 12-ish in there. That was when he started definitely becoming a senior. And then, but we've been able to do these old dog checkups.
Yeah, little tune-ups, they're always really good.
Yeah.
So I think this is just really common in Dalmatians. Have you heard
so.
that
I
too?
think so. I think the
Spinal.
yes, is much more than I realized. Yes.
Like, is it all the Dalmatians?
I think it's all the
When they get
Dalmatians,
to a
but
certain age,
yeah,
I'm wondering.
yeah.
But
who knows?
maybe not all of them.
Yeah, I'm certainly 2 for 2.
Yeah.
But again, hers was much more pronounced and had a lot earlier
Yeah.
onset than his. But she
Yeah.
was also.
How old was she when she first?
Gosh. So she would have been.
I know.
I'm going back in time. 8 or 9 when we first came to see you.
Wow.
Yeah.
Oh yeah. See, that is kind of young.
Yeah.
I know. I like to see them like at 11 or 10. You know, then I'm like, okay, the older dogs.
Yeah.
But
Yes. Because we lost her at 11, almost 12.
it was a good run for her.
Yeah. So it was.
And she was the best.
She was the
Loved
best.
her.
She was the best.
I know, JJ.
Yes.
You're wonderful.
Your own.
Yeah, you could do acupressure on these spinal points. I mean, all of these points. So bladder 23, you can do little clockwise circles. When you get down to bladder 28, you can feel a little restriction there, and you can help that restriction by doing little clockwise circles. Clockwise circles, you can feel, it kind of gets your hands in his fascia a little bit. I know that sounds weird, but just then you can feel if there's anything change, you know. Yeah, you're done. Are you all done?
What's that?
Yes.
Good boy.
You're a good boy.
Good boy.
And I think we've been doing B12 with him.
Yes.
Okay, just looking here. JJ, you're such a good boy. Do you want some vitamin B12 too?
I don't think we need any Adequan though.
Okay. I don't think we've gotten it recently.
I don't think so. No. I don't think so.
I think we might have done it once when we first No, that was Rocco.
Oh, that was
I don't know
Rocco.
that I've ever
Okay.
done that. Oh, we've got that in our back pocket
Yes,
if we ever
yes,
needed it.
yes.